Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. So today's video is on chronic fatigue syndrome. So this is a condition also known as myalgic encephalomyelitis. So it's complicated. It causes extreme fatigue, which lasts for at least 6 months. So your symptoms can worsen with physical and mental activity, which don't improve with rest. So people believe that it can be triggered by a combination of factors, and there's no single test to confirm a diagnosis. And the treatment for the condition is focused on easing symptoms. So typical symptoms are extreme exhaustion after physical and mental exercise, problems with memory or thinking skills, dizziness which worsens with moving from lying down or sitting to standing, muscle or joint pain, and an unrefreshing sleep. Also, other symptoms include headaches, sore throats, and tender lymph nodes in the neck or armpits. So people with this condition can also become extra sensitive to light, sound, smells, food, and medicines. So there are various causes believed to be. So one of them is genetics. So it appears to run with people in families. So people who are born with a higher likelihood of developing disorder. Infections. So if you get a bacterial or viral infection, you're more likely to get after that. Physical and emotional trauma. So if you've experienced an injury, surgery, or significant emotional stress shortly before symptoms began. And problems with energy usage. So some people have got problems converting the body's fuel, such as fats and sugars, into energy. So for the diagnosis, there's criteria. So it has to be so severe regarding fatigue that it interferes with the ability and engage in pre-illness activities, of new or definite onset, not substantially alleviated by rest, is worsened by physical, mental, and emotional exertion. You have difficulty with memory, focus, and concentration. You have dizziness that worsens with moving from lying down or sitting to standing, and it has to be there for at least 6 months minimum. So also looking at sleep disorders. So fatigue can be caused by sleep disorders. So if your rest is being disturbed by a disorder such as obstructive sleep apnea, restless leg syndrome, insomnia, you've got other medical problems that are quite common with this, such as anemia, diabetes, underactive thyroid. So you can have lab tests done to rule that out first. Mental health issues as well. So you can see a counsellor to see if it's determining any depression, anxiety, and as well as there's also sleep disorders, irritable bowel syndrome, or fibromyalgia. So the symptoms between this condition and fibromyalgia overlap, but they are two disorders with different aspects of the same disease. There is no treatment for CFS. Treatment is focused on symptom relief. So the most disruptive or disabling symptoms should be addressed first. So for pain, these include pregabalin, duloxetine, and amitriptyline. So why that is because medicines such as ibuprofen and sodium naproxen, if they don't work, you sometimes get prescriptions used to treat fibromyalgia, which might be options. So those are, as I said, pregabalin, Lyrica, duloxetine, and amitriptyline. For orthostatic intolerance, people with this condition, sometimes adolescents, feel faint or nauseated when they stand or sit upright. So blood pressure medication is helpful. And for depression, if you get low doses of antidepressants can help with that, regarding that, to improve sleep and relieve pain if you've got depression symptoms, etc. So that's the end of today's video. So feel free to like, share, and subscribe. Thank you. Bye bye.